Original Medicare provides excellent coverage, but for many people, it's not enough. So how do you choose between Original Medicare or a Medicare Supplement plan or Medicare Advantage? Hi there, my name is Sarah, and I'm here today with iHealthBrokers to discuss your Medicare options. So welcome to our channel. At iHealthBrokers, we are licensed health insurance brokers, and we are licensed nationwide. So if you have any questions whatsoever, please feel free to send us a message in the comments. And as always, you can give us a call at 888-410-0344. There is absolutely no charge for our services or pressure to buy. We are more than happy to help. And of course, please make sure to like this video. Liking this video will make it more visible to others looking for the same type of information. And as always, please make sure to subscribe. That way you can stay up to date because we do release these videos on a weekly basis. Now, if you'd like to learn more about Medicare, stay tuned to the end of the video where there will be a Medicare playlist. And of course, you can make sure to check out our channel because we've got plenty of videos about Medicare and health insurance in general. You can also find us on Facebook, TikTok, Twitter, and Instagram at iHealthBrokers, in addition to here on YouTube. Okay, so today we're going to be focusing on your Medicare options. So let's start with Original Medicare. Original Medicare is Part A, which is your inpatient insurance, and Part B, which is your outpatient insurance. Part A will cover your hospital needs, such as inpatient care in a hospital, nursing home care, nursing facility care, home health care, and hospice care. Then there's Part B, which is your outpatient insurance. It's going to cover wellness visits and preventative services and medically necessary services. So it's going to cover doctor's visits, mental health services, outpatient services, ambulance rides, clinical research studies, durable medical equipment, and some very, very limited prescription drugs. Most people pay no premium for Medicare Part A. However, for Medicare Part B, there is a monthly premium, and in 2022, it's $170.10 for most people. It may go up if you have a higher income. Then, of course, there's coinsurance and copays and deductibles that you need to be aware of. So with Medicare Part B, the deductible is actually only a once annual deductible of $233. Once you've met that, you'll be responsible for coinsurance. Part A is a little bit trickier. Part A is applied per benefit period, which is basically like a hospital stay. We go more in depth in another video about the Part A deductible, which I will put in the description below. But you could have more than one benefit period per year if you have major medical needs. And if that's the case, you'll have to meet that deductible multiple times in 1 year. Now in 2022, the Part A deductible is $1,556. Then there's coinsurance and copays. For Part B, your coinsurance is 20% of the Medicare approved amount. Now for Part A, it really depends upon whether you're receiving services in a hospital versus a skilled nursing facility and how long you've been there. It could be $0, it could be a couple $100s per day. Again, we go more in depth in another video, which I will put in the description below. This can be a major problem if you have major medical needs. Now that you understand Part A and Part B more or less, let's talk about some of the drawbacks. So first and foremost, there's those unknown costs, which are the deductibles and copays or coinsurance, which we already really touched upon. And then there are some missing benefits. So the Part B deductible is actually not that big of a problem, and you really can't avoid it even with a Medicare supplement plan. However, the Part A deductible certainly could be a big problem. This is, as we discussed, because you could have more than one benefit per year. And if that's the case, you would need to meet that deductible again, and that can certainly be cost prohibitive. Then there's the copays and coinsurance. Again, for Part B, it's really dependent upon your needs. You could have higher needs, you could have lower needs. And for Part A, it depends upon the type of service, whether you're in a hospital versus a skilled nursing facility, and how long you've been there. It could be up to a couple $100s per day. Now, these costs really begin to stack up, and the major problem is there is no out-of-pocket maximum with Medicare. So if you have extensive medical needs, there's no out-of-pocket max that's going to step in and protect you. Also, Original Medicare may not cover all of your needs. Now, Original Medicare is highly comprehensive coverage. However, it doesn't cover dental, vision, hearing, or prescription drug coverage. Chances are you're going to need one or more of these services, which means you're going to need an additional type of plan. So if you want to mitigate that risk or you're interested in additional benefits, you're going to want to look at a Medicare supplement plan, also known as Medigap plans, or Medicare Advantage, also known as Medicare Part C. As we've discussed, Medicare Part A and Part B will cover most of your medical needs. However, there are gaps in the form of deductibles, coinsurance and copays, and out-of-pocket maximums that aren't covered by Medicare. And that's where Medicare supplement plans step in. Medicare supplement plans, also known as Medigap plans, will cover those gaps. How much of the gaps depends upon the plan that you choose, but they will basically help to cover or cover the entirety of your deductibles and copays and coinsurance. And of course, by the very nature of a Medicare supplement plan, they will impose some type of out-of-pocket maximum. There are 10 different plans to choose from, which are available on Medicare.gov if you want to learn a little bit more. Now, which is the best plan, of course, depends upon your specific needs. Remember, Medicare supplement plans are standardized. That means the benefits that they offer are going to be the same regardless of who your carrier is. So Plan G will be Plan G, Plan N will be Plan N. And if your doctor accepts original Medicare, they accept your supplement plan. That makes it much easier to comparison shop. So this may sound great, but what are the drawbacks? Well, of course, there's an additional fee to take into consideration. There are no additional benefits offered that aren't already offered by Medicare, and you may be subject to medical underwriting. So first and foremost, obviously, if you're going to enroll in a Medicare supplement plan, there is an additional premium that you may need to pay. And if you're already on financial restrictions, this may be too tight of a squeeze. Also, there are no additional benefits offered by Medicare supplement plans that aren't already offered by original Medicare. Medicare supplement plans are really just there to mitigate the financial risks of original Medicare. You're not going to get dental, vision, hearing, prescription drugs, etc. They don't offer extra benefits, they just fill in the financial gaps. Finally, you may be subject to medical underwriting. If you don't enroll in a Medicare supplement plan during your IEP, which is when you're first eligible for a Medicare supplement plan, then you may be subject to medical underwriting. This means you could be charged more or denied outright. This is important to take into consideration because when you first turn 65, your medical needs may not be that great. And perhaps you're thinking you'd like to put off enrolling in a Medicare supplement plan because right now you can get by with just original Medicare. That's absolutely fine, and many people do choose to pursue this route. But you should know that should the day come when your medical needs are larger, and at that point you choose to enroll in a Medicare supplement plan, like I said, you may be subject to medical underwriting, which means you could be charged more than if you had enrolled when you were first eligible. Finally, let's talk about Medicare Advantage. Medicare Advantage plans are also known as Part C plans. They are different than Medicare supplement plans, and it's very important that you understand the difference. Medicare supplement plans work with original Medicare. Medicare Advantage plans replace original Medicare entirely. They must offer at least the same benefits of original Medicare, but very often they'll throw in a few extras. So Medicare Advantage plans will offer you a little bit of additional protection not offered by original Medicare alone. They will have some type of out-of-pocket maximum to protect you, which is great news. Additionally, very often they will have fringe benefits like dental, vision, hearing, and prescription drug coverage, not offered by original Medicare or Medicare supplement plans. And very often they're much less expensive than Medicare supplement plans. So this all sounds good. What are the drawbacks? Well, basically, since you are giving up original Medicare, you're giving up access to that extremely broad original Medicare network. You have that with original Medicare alone, and you have that with a Medicare supplement plan. This may not sound like such a big deal, and in certain areas of the country, it's not. But in certain places, it can be very, very difficult to find a doctor or a hospital who accepts your Medicare Advantage plan. Also, as a side note, these plans are not standardized. Plans differ from carrier to carrier tremendously, and those benefits can change on a yearly basis. So it's very important that you review your plan during the AEP to make sure that it's still the right plan for you. If you liked this video, and I hope you did, please make sure to click that thumbs up, give us a like so we can get this information out there, and make sure to subscribe because we do release these videos on a weekly basis. Now, if you have any questions whatsoever about your Medicare coverage or health insurance in general, please feel free to send us a message in the comments or give us a call at 888-410-0344. There's absolutely no charge for our services. We are more than happy to help, and there's no pressure to buy anything, but we really are the Medicare experts. Of course, you can find us on Facebook, TikTok, Twitter, and Instagram. And if there are any videos you'd like to see or anything you feel like we left out in this video, make sure to let us know in the comments below. Thank you so much. We'll see you next time. Bye-bye.